be talking about cyanotic congenital heart defects. The 5 primary cyanotic congenital heart defects are the 5 T's. And these 5 T's are your transposition of great arteries, Trunkus arteriosus, tetralogy of Fallot, tricuspid atresia, and total anomalous pulmonary venous connection. The 3 other ones I'll be talking about at the end would include the hypoplastic left heart syndrome, double output right ventricle, and Apstein's anomaly. Now, before I even get to all of those, I will first briefly talk about something called the Eisenmenger Syndrome. In Eisenmenger Syndrome, a left to right shunt through a VSD is reversed and becomes right to left. And in other words, an acyanotic defect becomes cyanotic. And the reason that happens is because when you have a left to right shunt, you have now excess flow of blood into the right ventricle, and all that excess flow is then transferred to the lungs. And when you have excessive flow to the lungs, that increases pulmonary resistance, and that increase in pulmonary resistance back pressures on the right ventricle, causing right ventricular hypertrophy and an increase in right ventricular pressure. And when the pressure in the right ventricle exceeds the left ventricle, the flow is going to reverse and become right to left. In other words, deoxygenated blood is now going to be transferred to the left side of the heart, which is going to pump it to the body, and therefore you have cyanosis. So now I'll begin talking about the 5 T's, beginning first with a transposition of the great arteries. There's 2 types of transpositions, D transposition, shown here, and L transposition. D transposition involves an AV concordance, in other words, right atrium to right ventricle, left atrium, left ventricle, and the VA discordance, in other words, right ventricle to aorta and left ventricle to pulmonary artery, okay? AV concordance, VA discordance. L transposition, on the other hand, has both VA discordance but also an AV discordance. In other words, not only do you have right ventricle to aorta, left ventricle pulmonary artery, but you also have right atrium to left ventricle and left atrium to right ventricle. And then L transposition is also known as corrected transposition, because when you have an AV discordance and a VA discordance, everything is fine. It's just that in D transposition, shown here, when you only have AV concordance, VA discordance, that is problematic. So in a D transposition shown here, you have deoxygenated blood coming into the right ventricle, pumped back to the body, whereas oxygenated blood coming from the lungs into the left ventricle is pumped back to the lungs. In other words, you have all the oxygenated blood stuck on this side and all deoxygenated blood stuck on the right side. So you can see that because the body is only receiving deoxygenated blood, that is actually very dangerous. That is going to result in death immediately. And therefore, when you're born with D transposition, there's always an ASD, a VSD, or a patent ductus arteriosus. And the reason for that is because you need to, in order to survive, you need to have at least mixed blood going to your body. So having an ASD or a VSD or a patent ductus arteriosus will allow oxygenated blood from the left side of the heart to be shunted into the right side of the heart so that it can then be pumped to the body. So in other words, the body is going to be receiving both deoxygenated blood and oxygenated blood. This detransposition used to be corrected with a procedure called atrial switch, also known as a Mustard procedure. And basically what that means is that you would create a baffle that would directly connect the left atrium to the right atrium, so that oxygenated blood coming from the lungs into the left atrium would go to the right atrium, then to the right ventricle, and to the rest of the body. But deoxygenated blood coming into superior inferior vena cava would be redirected so they go straight into the left ventricle. So you can see what's happening here. You have deoxygenated blood going to the left ventricle, to the lungs, oxygenated comes into the left atrium, to the right ventricle, to the body. That all sounds good, but the right ventricle is not built to pump blood to the body. It's, that is not its purpose. So over a long period of time, the right ventricle, the right side of the heart, begins to fail. Okay, so this atrial switch is not a cure for detransposition. So what they use nowadays is what is called arterial switch. And basically what you do is you switch, just simple, you just switch the aorta with a pulmonary artery, but you do not touch their valves. You leave the valves intact, you just switch the arteries. And not only that, but you also have to translocate the coronary vessels that arise from the pulmonary route, from the aortic root. Okay, and that's your arterial switch. And that is what's used nowadays. And when you switch the aorta with a pulmonary artery, the heart resembles completely normal heart, so it should be fine. The next cyanotic defect is Trunkus arteriosus. So in Trunkus arteriosus, what you have is a single trunk that directs blood to the aorta and pulmonary arteries at once. So not only that, but this Trunkus arteriosus is always associated with a VSD, ventricular septal defect. So now you have deoxygenated blood from the right ventricle and oxygenated blood from the left ventricle, both going into the aorta and pulmonary arteries. So you can see it results in cyanosis because you have mixed blood going to the body. But not only that, you also, because you have both of these pumping into the same artery, there is going to be pulmonary hypertension, excessive flow to the lungs, pulmonary hypertension. So there's cyanosis, pulmonary hypertension, and finally, during diastole, you know that coronary arteries, they supply blood to the ventricles during diastole, but in this case, when the ventricles relax, the blood coming back down, a lot of it is going to go up to the lungs. So there's going to be less going to the coronary arteries. So it results in coronary ischemia. So again, those three problems here is cyanosis, pulmonary hypertension, coronary ischemia. So in order to correct Trunkus arteriosus defect, what the surgeons would do, they would close the VSD with a patch, and then they would create a conduit or a tunnel that would directly connect the right ventricle to the pulmonary arteries, okay? And that should help correct the problem.